Dr. Sills, going back to last March when the country was shut down, when the whole world came to a screeching halt because of the coronavirus, and we didn't know much about it. At that time, how much doubt did you have that the 2020 NFL season would actually be played?
Well, I don't think we actually looked that far down the runway. I think we realized in March that we had a long time before our season started and we were going to have the opportunity to learn a great deal. So we did start our planning process then. We set up a number of combined committees between the league and the NFL Players Association. We started tackling the issues. But we recognized that any decisions that we could defer were probably in our best interest because we just knew we were going to learn more. This was such a novel and emerging virus. There were so many unusual things about it that I think that we wanted to gather more data and have a better sense of where things might be going. And we also realized early on that we were going to have to evolve. We would have to change our protocols and be willing to update them. And that's obviously very different. I mean, in the NFL, we're accustomed to putting out a schedule and having it out a year in advance and knowing when everything was going to happen. And so we were going to have to operate in a very different framework in order to get through this successfully.
Just how much collaboration did it take to be able to put out those protocols and have everyone follow them?
Well, there was tremendous collaboration. In fact, I don't think we've ever worked more closely. On the medical side, we've always worked very closely with our colleagues at the NFL Players Association, but we spent hours and hours meeting together with not only our staffs, but experts that we each brought to the table. And again, those are very collegial and collaborative discussions because we all had the exact same goal. We all wanted to create the safest possible environment because what's good for players is good for coaches, is good for staff, is good for the game, it's good for society. So it was a very mutually beneficial process. And it's one, again, that continued starting really back in March all the way through the entire season.
Dr. Sills, was there a point at all during this season when you thought that maybe it was in jeopardy, that maybe you would have to stop, that you would have to delay it?
Well, I think when we got into the period around Thanksgiving and we saw cases really spiking throughout the country, we knew our job was going to get a lot harder. There clearly were signs throughout society that cases were increasing, the community burden of disease was increasing, and we saw our own cases increase. We had just come off the heels of an outbreak in Baltimore. So that's the point at which we put all of our clubs under this intensive protocol and said, you know, we need to pull out all the stops here to really try to create the safe environments and to block transmission within our team facilities, because clearly we've got to do something different than what society is doing, because the case numbers in society were very much going against that trend at that time.
As you and I sit down days ahead of the Super Bowl, not only did you get here, but you got here on time. None of the games were canceled. You played the full regular season, the full playoffs, all on time. There were obstacles. You overcame those. How exactly did you pull this off?
Well, it has to start with the individuals involved, with the players, with the coaches and the staff at the team level. They are the people who made the very hard sacrifices and did the hard work on a daily basis over a 7-month period. And no matter how good your protocols are, if you don't have the buy-in and the trust and the adherence of every single person, it just doesn't work. And, you know, we said throughout that this is something where 90% is not a passing grade, it's a failing grade. We had to be at 100% to keep everyone safe. So I tip my hat again to the players, to the coaches, to the staff members, the medical staffs. They did the hard work every single day of keeping themselves and keeping the team environment safe. And I think there was just tremendous collaboration. Again, we were able to work very closely between the league office, our medical advisors, the Players Association, and the individual clubs, because this season was about us all pulling together. I've often said in a usual season, it's very much the Packers against the Bears, right? Or the 49ers against the Seahawks. This season was about us as a league against this virus and trying to get through it safely. And so I think that spirit of collaboration, that spirit of togetherness and sharing, that's what has seen us through this.
I like that analogy. One of the biggest questions we all had from the start was how could players participate in what is a contact sport during the pandemic? And you guys proved otherwise, that it's possible. How exactly were the players on the field able to hit each other, stand so close in a huddle, be around each other in practice, and yet avoid transmission of this virus? What did you learn?
Well, I think we learned a couple of important things. I mean, first and foremost, we obviously tried to make sure that no one who was infected was on the field with our screening and testing. But there were situations where we found out later someone was infected. And I think what we learned from those experiences is being outdoors or in a large, well-ventilated space like our indoor stadiums are is a really big, important factor here. When we also looked at the data for our contact tracing devices, as you know, every player on the field wore a device that measured their contact with all other players and coaches and with the game officials. We saw that even though players are lined up close to each other and they're tackling and doing all these things, when you sum up all those interactions, it's still a fairly brief exposure. So we had a number of very brief exposures happening in an open air, a large air environment with great ventilation, with a lot of air movement and a lot of position changes in and around the field. So I think that we've come to realize that all of those are protective factors and things that minimize or mitigate against the spread of virus. So as you said, our data showed pretty conclusively that we did not have any transmission on field. As we like to say, the virus never crossed the line of scrimmage as near as we can tell. And I think that is an important observation, not only for the NFL, but sports and society at large.
Speak a little bit more about that, Dr. Sills, because you guys collaborated with the CDC on putting out a paper on all of everything that was learned during the season. And what do you see as the most beneficial parts to that for the general public? What can you take out of what the NFL learned and apply it to everyone living in everyday life?
Well, we're really proud of that association with the CDC to put this paper out. And we said throughout that we wanted to take our experience and what we learned and use it for the benefit of everyone. So this paper is a tangible sign of that. I think the most important takeaway was when you look at what kept us safe, it was not the fact that we tested every day. It wasn't the fact that we wore these very fancy, expensive tracing devices that measured all the player movement. What prevented transmissions was things like consistent mask wearing, outdoor events, avoiding indoor meetings, avoiding having meals together, prompt reporting of symptoms, aggressive isolation of anyone who's been exposed, aggressive isolation of anyone that has symptoms. And I think the great thing about those observations is those things are not resource intensive. They don't require all this money to do testing or require the purchase of new technology. They just require having a consistent protocol that, as we said earlier, is applied to everyone and that everyone buys into and adheres to it in all situations. So I think that's the really big take-home message from this paper is that, as I've often said, eliminating spread or preventing transmission of the virus is not complicated. It's not easy because you have to do it every day, all the time, but it's not complicated. We know the measures that it takes. And if everyone can pull in the same direction to do those measures, you can keep a team safe. You can keep a school safe. You can keep a business safe.
One last one. Do you see a finish line? Do you see light at the end of the tunnel?
Well, we like to say in health and safety, there is no finish line. We always want to see the game made safer and better for everyone involved in all aspects, not just in infectious disease, but in concussion and soft tissue injuries and lower extremity injuries and all the things we work on. But I think we all are very, very encouraged about where vaccination is going to take us. We all believe that getting people vaccinated is going to be a key to us resuming what we would consider more normal activities. So we believe that the vaccine is very important for everyone to get. We're going to do all we can to support it. When it comes our turn, we're going to do everything we can to educate and encourage everyone to get it. So I do think there's a light at the end of the tunnel, but we can't be complacent, and certainly now not the time to relax. We've all got to stay vigilant and continue to keep each other safe to get to where we want to be for future seasons.
Well, one last one, because you just mentioned the vaccine, and I recall what D. Smith said last week, and the conversation hasn't even been had because the season is about to end and there's no urgency. What do you see as far as when it comes to the NFL and your turn for that vaccination? Are those conversations that you're waiting on? What do you anticipate happening there?
Well, I think we'll continue to have a lot of conversations with each other, but make no mistake, both the Players Association medical advisors, our medical advisors, we're all in favor of vaccination. We all believe it's very important. We think it provides safety and it provides so many benefits. And so we're going to do all we can to educate everyone, to show them that path, to model that behavior. As a doctor, I've already been vaccinated. I wanted to do it as quickly as I could because I think it keeps not just me safe, but it keeps my patients safer, the people that I'm caring for. So we'll have a lot more time to work through that idea. We'll work on it collectively and collaboratively, but we also don't want to get in front of the line. We've said that we want the public health authorities to establish that priority order of who should be vaccinated. And when it's time to consider professional athletes and consider the NFL, then we'll work hand in hand, just like we have all the way through this pandemic.
Dr. Sills, thank you so much for your time, not just today, but throughout the season. Really appreciated those phone calls all year long. They were very informative and gave us a lot of information. Thank you so much.
Hey, thanks for having me.